Hi, this is Anna, and these are my audience members. Imagine for a minute that you're a nurse in a hospital. You have 5 patients. You have a troublesome patient that is confused from the high-risk pain medications and anesthesia from an abdominal surgery to remove his appendix. The patient requires lots of one-on-one attention, and the CNA is busy in another room assisting a different patient. You, the nurse, are already behind in your day, and you have to tend to a priority with another patient in a different room. You are gone for 10 minutes, and you go to check on your abdominal surgery patient, and you find him on the floor bleeding from his head extensively. You put on gloves and grab a towel and put pressure on the wound because of the blood thinners he is on to prevent clots. He bleeds through the towel. You yell for someone to come to help you stop the bleeding, and you send him down to get a CT scan of his head. You take your gloves off and notice there's blood on your hands. Your glove must have a hole in it. Your hands are chapped and cracked from all the hand washing you do at work. Do you worry about it? Or do you wash your hands and go about your day? Now, imagine that this patient is not diagnosed with HIV, but has a history of using IV recreational drugs that he has never reported. In fact, he has never been tested for HIV because he has no symptoms of it. Now, you may just have contracted HIV. Annual HIV testing should be mandatory for all healthcare workers. This story brings me to my 3 main points. The HIV epidemic is being spread unknowingly. Patients could have HIV that is misdiagnosed, and healthcare workers are at high risk for HIV. Let us start with my first point. Healthcare workers should be tested annually for HIV. The HIV epidemic is being spread unknowingly. According to many authors of the article, routine HIV screening in 2 healthcare settings, New York City and New Orleans in 2011 through 2013, 16% of over 1.1 million people with HIV do not know that they are infected with the virus. That is over 176,000 people that don't know. Think about that for a second. Among those people, how many do you think that has high-risk behavior such as having unprotected sex or use recreational IV drugs? Additionally, Dr. John Galinsky of Santa Clara University states in an article, AIDS, Privacy, and the Community, the Ethics of Mandatory AIDS Testing and Disclosure. There is a documented long period of time between the time a person first contracts the virus until the person has positive results on antibody tests. Additionally, there have been false negative and false positive results reported on these antibodies tests. This could cause misdiagnoses for sure. Now, you know that how the HIV epidemic is being spread unknowingly, that this is another reason that healthcare workers should be made to get tested for HIV. Secondly, patients could have HIV that is misdiagnosed. According to Ignatius and Workman in Chapter 21 of the textbook Medical Surgical Nursing, Patient-Centered Collaborative Care, 50 to 90% of recently infected people develop an acute infection within 4 weeks of contracting HIV. These symptoms include fever, night sweats, chills, headache, and muscle aches. These same symptoms could be caused by almost any other virus as well. Have you ever went to the doctor for an illness and the doctor takes one look at you and says, "It's viral, go home and get some rest. There's nothing that I can do"? I know I have. Even Joanne Santangelo, a nurse practitioner, informs us that patients have visited ambulatory care settings with what is called acute human immunodeficiency virus seroconversion illness, but it frequently is diagnosed as something else. HIV seroconversion illness is what happens after the first initial exposure to the HIV virus. Santangelo also informs us that in a study of individuals who engage in high-risk behaviors, 90% of these individuals that had the initial flu-like symptoms sought medical evaluation. The disturbing part is that a primary HIV infection diagnosis was considered in only a handful of these patients. Now you see from my second main point that how easily HIV can be misdiagnosed. Third, I would like to stress why healthcare workers are in danger. Healthcare workers are at high risk for HIV. Kahn and his colleagues state that in a journal article, needle stick injuries, risks, and preventative factors, a study among healthcare workers in tertiary care setting or care hospitals in Pakistan, there is an estimated 385,000 needle stick and sharp related injuries occur every year to healthcare workers in hospital settings in the United States. Also, out of 39.5 million healthcare workers, there are 3 million percutaneous exposure to infectious diseases, and 2.5% of these are HIV exposures due to needle stick injuries. According to Henry M. Wu and Ramana Dahara and Alan Zarkowski at the Centers for Disease Control and Prevention, in the article Occupational Exposure for exposure to HIV, there are many factors that put healthcare workers at risk for HIV transmission. Basically, if a healthcare worker is exposed to blood, cerebrospinal fluid, synovial fluid, pericardial fluid, pleural fluid, peritoneal fluid, amniotic fluid, semen, and vaginal secretions by way of needle sticks, splash exposure to mucous membranes, or non-intact skin, they are at risk. So, I have explained in my third main point why healthcare workers are at high risk for contracting HIV. Now, let me reiterate the seriousness of this issue. As Elizabeth Taylor said, it is bad enough that people are dying of AIDS, but no one should die of ignorance. And it is ignorance to ignore the facts. It is a fact that there is a latent period between the time of initial infection and HIV when the person that contracted the virus shows symptoms. It is a fact that there are thousands of people that have HIV and do not know it. It is a fact that HIV gets misdiagnosed with other common viruses due to the similarity in the symptoms. And finally, it is a fact that healthcare workers come in contact with all forms of bodily fluids by many different people that may not know they have HIV, which puts the healthcare worker at risk. So, let us come together and make the proper steps. Annual HIV testing should be mandatory for all healthcare workers because the HIV epidemic is spread unknowingly. Patients could have HIV that is misdiagnosed, and healthcare workers are at high risk for HIV. Thank you.